Hello, everyone. Thanks for joining the webinar, Patient Engagement in the New World, Getting the Tools in Place. We've got a number of people who are still joining and logging on, so we want to give them just a moment, but we'll get started very soon. Thanks. All right, still some attendees joining, and that's fantastic, but we'll go ahead and get started. Again, this is Patient Engagement in the New World, Getting the Tools in Place. We're thrilled to have you join us today for the discussion. I'm going to just do a shameless advertisement right at the beginning. Oh my gosh, right out of the gate, he's doing that. But just invite you to real quickly connect with us, Solution Reach on Facebook, on Twitter, LinkedIn. You'll get a copy of this recording afterwards. You can come back and look at that. No need to jot it down. There's also a PDF of the presentation today in the handouts section and go to webinar. So you can access that there as well. So today, we're going to be joined by Mark Probst, who's the Chief Information Officer at Intermountain Healthcare, an integrated delivery network based in Salt Lake City. Mark's been involved with information technology and healthcare services for over 30 years now. He's a partner with Deloitte Consulting and Ernst & Young. He's also served as a board member of several healthcare-related organizations, including the Federal Healthcare Information Technology Policy Committee, that's a mouthful, and as the chair of the College of Health Information Management Executives, also known as CHIME. And also, excitingly, Mark was recognized by CHIME and HIMSS as the 2019 John E. Gall Jr. CIO of the Year. So a great honor, and we couldn't be more thrilled to have Mark with us today. As for myself, that's me on the right, Justin Everett. I'm the Vice President of Marketing at SR Health by Solution Reach, and I've been in the patient engagement and patient communication space for a little over 15 years now. And I just love joining forces with individuals like Mark and other thought leaders in our industry to help them share their experience and best practices in a way that's helpful for all of you. And that's exactly what we've designed today's discussion to be. So we're going to pick Mark's brain about how he's approaching COVID and patient engagement from the CIO seat, and we want to make it interactive as well. And so to that end, also on the call today is Leah Chatham. She's lurking in the background. She's our Director of Content Marketing for SR Health, and she's going to help us out by monitoring the Q&A in the chat. And, you know, whatever thoughts you've got as we're going along, again, it'll just kind of be almost sort of a fireside chat between Mark and I, but we invite your questions and your comments. So if we're going through and you've got something you want to ask, please put it in the Q&A or the chat, and we've asked Leah to interrupt if any juicy ones, or Leah said apropos. I like juicy. If any juicy ones come through, we'll ask her to jump in and share those and prompt us with those. And also on the housekeeping front, just a couple of questions that we always get here, so I'll address them right up front. One, in addition to the slides being here as a handout in the GoToWebinar platform, we'll also plan to send a recording out afterwards. So if you have to drop early, no worries. We'll get you the recording later, or if you want to share it with someone. And then also, if you happen to get kind of a choppy audio issue and you're listening through your computer, our recommendation there is always to switch to the phone. A lot of times that'll resolve that for you. So that's kind of how a couple of housekeeping pieces. And if you got questions, either technical or content related along the way, we'd love to hear it and address it. So here's what we're doing today. We've got, we're thinking about how do we patient engagement in the new world, right? And how do we get these tools in place? And Mark and I, as we were talking about, well, what do we want this discussion to be today? It was really three pieces. It was It was first, what does this changing landscape that's evolving every day, what does it mean for everyone? And everyone's a key word there. It's not just patients, but what does it mean for providers too? And so what are some of the implications of that? So we've got a few questions we'll explore there. Mark will share some experiences, and we'll want to hear from you. And then secondly, for how that changing landscape is evolving, how have we solved for some of those needs and requirements and demands to date? What have we done, up to June 18th to get us where we are? And there's some different approaches everyone's taken. And then third, okay, we go forward from here. We know this is what we've got to go solve for going forward. There's going to be a new approach. Well, how do we approach the new approach? And so that's how we've a structure that we think makes sense for today. And we'll jump in and start with that landscape piece. What does that mean for everyone? And we've got a few questions we want to talk through here, and I'll invite Mark in now and just ask Mark, from your perspective, from that CIO seat, what are you seeing within your own organization? What are you hearing from your peers around what patients are going to expect going forward?
Thanks, Justin. I appreciate that. And first of all, I hope that everyone out there is safe and well and, healthy in this really weird time. I mean, difficult in many ways, but certainly weird for someone like me. And I'll just correct one thing, and this is not Justin's fault. I'm sure I gave you a bad bio. I've actually been doing this for about 40 years. And I only bring that up because, we talk about what does this mean for people? And you know what? I wish I knew. I mean, after doing this for 40 years of technology and healthcare and being involved with large integrated delivery systems, I've never seen anything quite like what's happening today. And I think it really is going to make for an opportunity for all of us to learn together. So that interactive component that Justin was talking about, I mean, if you have thoughts, ideas, if you think what I'm saying is stupid, I think it's great. Let's share that, because we're going to learn a lot together over the next, not a lot in the next 45 minutes, but over the next several months as we're working together, we're going to learn a lot. So, to get to your question, Justin, what are patients expecting as we go forward? Well, I think I'll just give you my kind of thinking around that, and I'm sure there's better thinking out there. But I don't believe, patients, what they're expecting is to have a safe interaction with their healthcare system. And what we're seeing as we start to bring back elective surgeries and bring people in for clinic visits, there is a hesitation. And that hesitation is, and we've seen it in EDs, we've seen people come in that haven't come in with relatively major health issues because they're worried about getting COVID-19 if they come into one of our facilities, because we're aggregating all the sick people. So I think foremost, they're looking for a level of confidence in that interaction and how they can come in and have good, safe care. To break that down just a little bit, I think they're looking for no waiting rooms. And we're seeing that. We're seeing organizations, even internal to our own and elsewhere, that, waiting rooms are gone. You're basically either timed to come in at a time that's socially distanced or socially appropriate, or, you're waiting in your car and you're waiting for a phone call or a text or something to get you in. I really think that, the waiting room, we'd already talked about that prior to COVID of being something that needs to be in the past, but now we're going to have to actually implement that because the patients are going to expect it. And, the place I've experienced is at the barber, because I went like 3 months without a haircut. I looked like I was back in the 70s. But, certainly getting in line, right? I mean, they did not want me in that barber shop until it was my turn to come into that barber shop. And then, of course, we had all the masking and those kind of things. I think patients are looking for a lot less uncertainty about the information, about what they're doing with us. They would love to have opportunities to understand better, and as would we. We'll get to providers in a minute, but why they're coming to see us, and do they really need to see us, and are they going to the right modality of care? And I think they would like more certainty around that. They would really like yeah, it's interesting, more instant gratification. I've used when I speak, um, I've used the example, and I call it, and I'm sorry for the proprietary nature, and I don't mean it that way, but I've used the term Dr. Google. But what I'm talking about is AI-driven interactions that can, again, focus me on what my problems are, and it maybe even solve them. Maybe I don't have to go anywhere but to the pharmacy, and they'll deliver the drugs as well to get my prescription. But they want more instant gratification, and that kind of goes with the certainty aspect of what I talked about. I think patients are looking for a lot more. Oh, go ahead, Justin.
Yeah.
Do you have a question?
Do you think that's related to COVID, or is that something did COVID just kind of accelerate that?
I think COVID accelerated all of these things. I think one of the slides toward the end, we talk about, things that we were doing anyway, but I think it accelerated. And it also made a lot more people comfortable using the technology, right? I mean, even our docs that weren't all that old, they weren't using things like telehealth, and they weren't texting, and, some were, but I wouldn't say in general. And the patients themselves, they weren't as prone to use a digital connection into their healthcare provider. Certainly we've all got the portals and the digital connections into our health system, but they weren't using it as naturally and as effectively as I think they are now. Now that they're looking to get the value out of that and some of the things that they're used to in non-healthcare interactions. Pricing is going to be a big deal. Patients want a fair price. And we'll talk about some of the issues of cost, I think, a little later in this Q&A. Patients really want, I know they do. They want the very best care possible. And, at Intermountain, we've called it best practice care. I think that's caught on around the industry. We use care protocols that, really assure that across our 28 hospitals and all of our clinics that we practice medicine in a similar way. But they really want this, best practice kind of care. And to do that, we've not been successful doing that in a format that was just word of mouth or everyone researching what was in the journals. It really came down to technology supporting that process. And I think the patients expect it and deserve those kind of things. So those are the things that kind of come to mind. Anything else, Justin?
No, I think that's great insight there. But I think what I'd pose to you is kind of the other side of the equation there, from talking about patients expecting the best care and the providers that are giving it to them. What are some expectations on that end right now? What's kind of emerged in the last couple of months regarding what providers' needs are?
Well, our providers are certainly getting used to telehealth. I've heard statistics anywhere from 30 to 50% of the telehealth volumes that we have now in the midst of COVID, which are 1,000 times larger than they were pre-COVID, are going to stick. So I think the providers would like to keep the flexibility that having things like telehealth and digital interactions are going to provide. But they also are really focused on safety, and they love their patients. I mean, they really want to do the best care that they possibly can. So they're going to be looking for us to not just have telehealth as an excuse or an easy way to provide care, but it's the right way to provide it in the right modality at the right time. They want the right tools to do the job. I don't know about all you out there, but we brought on an awful lot of technology very, very quickly because of COVID. It forced us to do things, from homes, outside of the clinics, have different interactions. I think the providers expect that we will have a good, safe, consistent set of tools. The docs want to work, all the care providers, they want to work at the top of their license. And we need to figure out how to do that. I'm going to have my first telehealth visit on Monday. I'm not sure quite how that's going to work out. It's a specialist that I'm seeing, but it'll be interesting. It'll be an interesting learning. It'll be interesting for me to learn from. But this is how the clinicians want to do it, because I know we're open, right? Our clinics are now open. I could have gone in, but they're preferring to do this first visit with the specialist through telehealth. And, and again, people can work at the top of their license. Not every interaction with a patient is exactly the same. And now we can start looking at ways of using the technology, using the office visits, everything to get to the top of the license and make sure we're dealing with the right person. I think the providers love the flexibility in their schedule, and they're going to look for keeping that kind of flexibility. And I don't mean that just to make life easier. I think, we've got a lot of capability. We got a lot of patients, but we tend to work 9 to 5. And I think right now what we're seeing is, no, we can expand that quite a bit to be more helpful to our patients, but also more attentive to our clinicians as well. And providers understand that it's a team sport. What we do is a team sport in healthcare, and they would like to see us figure out how to facilitate that teamwork better than a lot of the word of mouth or a lot of the EMR that we depend upon. There's a lot of things that have to go in that space.
That's great. That's great, Mark. I think that's a good segue to our next question here, because you and I have spoken about that concept of healthcare being a team sport, and it's a matter of, patients and providers being on the same page there. How have you guys at Intermountain approached, making sure everyone knows exactly what's going on, and, just kind of as a joke on the side, we communicate and over communicate, but even beyond a communication standpoint, I'm curious to know what your experience has been there and how you approach, everyone being on the same page.
Well, I referred to the care practice protocols that we use. I mean, that is a tool that's primarily driven by the EMR, but I don't think that's near enough. And what we do is not ideal today. And we have talked about this before, Justin, but we use Vocera so that nurses can talk to nurses, and nurses can talk to doctors, and nurses can talk to bed control and maybe to environmental services. But that's one technology. We use email to communicate. We use the EMR to communicate. We use texting to communicate. We use cell phones to communicate. We use, and I'm sad to say this, we use pagers to communicate, and we also use faxing to communicate. And I am sure we look like 95% of all healthcare providers in the world. That, there are a lot of different pieces of technology that we brought in to enhance and allow this communication to go on. And everything I just outlined to you may be short of like texting and some emails and maybe a portal. They ignore the patient, right? I mean, it's how we communicate just within the very complex system that we have. We got doctors that need to talk to nurses. We need labs. We need pharmacy. We need environmental services. We need therapists. All these people are important components of care delivery, and the communication between them is just not very elegant. Try, Justin.
Yeah, no, I was just going to say that just on the internal side, I think that's pretty fascinating that it's so disparate in so many different channels there. I was kind of laughing. I had to explain to my 12-year-old what a fax is the other day. So,
hey guys, sure. on the communication front, we do have somebody asking a question about, and I feel like this is a communication question, which is why I'm stopping you to throw it out there. But essentially, what they're asking is, how do we keep our patients safe? How do we, with, maybe fewer staff in the office or fewer resources? And I don't know if you guys feel the same way about this, but when I've been doing webinars, we've been talking about, part of that is about communicating, right? It's about, making sure everybody knows how we're doing that and what the processes and procedures are and those kinds of things. What are some of the thoughts that you guys have about that?
Well, I can start. And maybe it's just some broad brush pieces. One, we've got to simplify our communication, both internally and externally. But what we don't need is just so many modalities of communication out there that make it hard for patients to interact with us. And again, I wish I was a best practice here. I wish we were, but we've got multiple 800 numbers. We've got multiple technologies that people can use to interact with us. And I think that makes it pretty complex, and it can make it unsafe because maybe we're using the wrong modality to get to them that their result of their cancer screening or one of their lab tests. So I think part of it is we've got to be much more mindful to our patients as well as our providers that we need to simplify this. We also need to be really careful, and I probably had notes later in this presentation, but now that you bring it up, Leah, is we need to keep our communications as close to what's natural for the patient or member or whomever it is as we possibly can. And I'm not anti-portals or that kind of thing, but for me, I just soon get a text message if it's HIPAA compliant and we take care of all the security pieces than it is to walk out, log into a different app, which is going into my healthcare provider and have to do something really unnatural to have that communication. So I think a big part of safety and quality is really being aware of how they want us to communicate with them and keeping it simple. Justin?
Yeah, I totally agree with you. And speaking from the point of view, this is about, COVID's here, but it hasn't changed the fact that I still want convenience and I still want ease of use. I've always wanted that, and probably even more so now. But I flipped our slide to the next one because I do think there's a safety component there, and making sure I feel like I'm dialed in with my provider, but I still feel like I'm safe, and whether that's from the comfort of my own home or wherever it is. I think just being able to naturally communicate back and forth through for me, like Mark mentioned, I'm right alongside him. For me, just being able to text back and forth is huge, and for me to be able to initiate that conversation with the text too. So not wait on an incoming text to me and respond to that, but for me to just go, if I've got a question here and I don't need to pick up the phone and call, easier for me to just fire off the text and be done with it and start it that way. So actually, I think I want to go ahead and move past this question because we've already talked about this a good bit, but I wanted to transition a little bit, Mark, over to the cost part of things. So, how are we going to reduce costs here? And given the new environment, can we do that? And what are your thoughts around that topic?
Well, it's interesting because just yesterday we had a major internal meeting at Intermountain Healthcare, and the statement was made by I think our CEO that the next acute crisis, so we're in the midst of COVID, but the next acute crisis will be affordability. And if we can't get our healthcare delivery to be more affordable, it's going to be a real problem. And so how are we going to reduce costs? Well, we're going to start minimizing the use of buildings as much as we can because we've learned that we can do that. That doesn't mean we don't have them. We have hospitals, we have clinics, and we will. But we got to use them more efficiently, and maybe we can actually close some down as we can become more virtual in the kind of care that we make. I think, there's things like redundant applications. I brought that up. Just in the space of communication, we have so many different things we're paying for, we're supporting, we're training people to use, we're integrating. We need to get to more consistent set of solutions. And that's going to take some thought and some strategy. It's not something you do overnight. And as you and I've talked before, Justin, I'm a big believer in platforms that allow us to do things versus, lots of niche solutions that we paste together. And I think maybe be interested in what other people think, but maybe because of COVID, we've learned something. Decisions happened so quickly. We spun up a command center in a matter of a day. We started bringing major issues into that so that we could get people working at home, so that we could leverage telehealth, so that we could understand what the federal government do it. All the things I know all of you did. But what we learned was we can make decisions much quicker and we can act upon those much quicker. We didn't get lost in all the bureaucracy of complex governance. Doesn't mean governance isn't important. I did not say that. But what it does mean is when we have urgency, we can really move and we can do some amazing things and move some mountains. And we've seen that through this process. So, yeah, capital expense is going to be less, no doubt about it. Operating expense is going to be less. What did we read? It was like, it's billions of dollars a month that we're losing in healthcare. Or I don't remember what the statistic was, but it was massive.
Wow. So just to put a bow on this part of the conversation, I'd ask you, and also encourage you guys listening to share your thoughts here. And really the overall question here as we think forward is, like, what does success look like for you? And what does it look like for your organization? And Mark, I'd pose that question to you. What does success look like right now versus, and how does that contrast with maybe what it looked like in the past, if at all?
Well, a lot of it has to do with the past, but what success looks like going forward is we need to provide at least the same quality of care that we're providing today, which is pretty high at Intermountain Healthcare. Hopefully we can provide even better care, and we need to be able to do it more efficiently. We need to be able to do it in a way that's affordable for our patients. And going back to that acute crisis, if people can't afford it, they won't get it. And if they don't get it, they're not going to get better, and we're not providing good care. So we've got to be able to lower costs. There's no doubt in my mind that that's going to be probably that's going to be the biggest issue sitting out there for the next 5 years. Now, as a technologist, I believe technology is going to help do that. And so there'll be some investment in this space, but we're going to have to lower costs. We've got to be able to bring the patients into the care process better. For the last 10 years, I've noticed that, we've always put the patient at the center of every PowerPoint presentation and have everything happening around them. The challenge here is everything's still happening around them. How do we make sure they're part of the decision-making processes on their care? How do we know in timely manners what's happening with them so that we can adjust a prescription or an antibiotic or even a physical therapy? How do we know these things in a much timelier basis, simple for our providers to consume and then make decisions and help move them forward? But I think that's what engagement is, right? It isn't the kind of engagement that's, oh man, Intermountain's got really awesome billboards and stuff on buses and TV commercials. That is a form of engagement, but the engagement we want is with their health, and that they know and we know we're together, along with family members and other people that are part of the care processes, that we're all in it together and we're working together to solve the problem. That's what success looks like.
But Mark, I'm a marketing guy. I like billboards and buses and stuff.
Yeah.
We don't. So that's, in all seriousness, that's great feedback. And I said we'd put a bow on this section of the bow. I'm about to put a bow on top of a bow here. And this is something, we kind of spoiled a little while ago. And there's just this notion that you and I have spoken about, we were already moving in this direction anyway. A lot of this stuff we're talking about, a lot of these advancements, we were already moving down the path, and COVID just made us do it faster. It kind of, it feels like it's forced our hand to do some of these things. And curious to know your thoughts on that, Mark.
Yeah, no doubt it's made us move faster. The challenge I think we have is we didn't necessarily do it with a strategy. And so we did it fast, maybe not in the most effective or efficient ways. It'll be interesting to see how some of our partners, vendors and those kind of folks, maybe our EMR vendors, if they were, because they had to solve problems as well. And I don't know this at all. And we're a Cerner user, and I think they're an excellent company. I love dealing with them. But, did they have to do things quicker than they would have liked to? And now is there going to be this period of time where we've got to kind of pause and take a look and say, what did we actually do? What worked really well? And then, how should we best move forward? But yeah, we were on almost all of these paths. Everyone on this phone call was, involved in much of this.
That's great, and that's a perfect transition to what I wanted to get into next, which was how we tried to solve for these to date. And as you and I were talking and preparing for today, we were we were really kind of talking about three different scenarios or approaches, and Mark, I'd love to get you to talk about this notion of niche solutions. You were speaking to it a moment ago, I think, with regard to even just internal communication. But would love to get your thoughts here.
Yeah, and I'm probably going to sound a bit like a broken record, and I'm sorry for that. But maybe I'll just take one step back. I've been in the industry a long time, like I said, and I've seen the pendulum swing between, best of breed niche solutions that are highly integrated and to, single solution kind of vendor products. And that pendulum's gone back and forth 3 or 4 times. Prior to COVID, we were very much, as an industry, focused on implementing EMRs. And in that kind of phase, we really went with it, and we're going to talk about EMRs here in a second, I know, Justin, but I will try not to get too far ahead of myself. But, that was, we had the stimulus package that helped fund that for us, and we worked really hard to get those EMRs in place so that we'd have data and be able to provide care and all the things that we talk about. But COVID has kind of pushed that back down toward niche solutions because, the EMR does a tremendous amount, but it certainly doesn't do everything we need within a health system. And so this is where we're getting lots of niche solutions, and it was offered to us in so many ways, right? I mean, how many vendors came to us and said, "Hey, we'll give you this for free. Just use it. This will help you with what you're doing with COVID." And we brought in a lot of these things. To me, that's been helpful. I really appreciate our partners for doing that. They're really good companies. But now, we are caught up in this, hey, everything doesn't integrate really well. The data that we're getting out of all these things certainly isn't normalized where I can do all the analytics that I'd like to do. And so I've got to take a look at this picture. There's place for niche solutions, and a lot of the really forward-looking companies have very niche solutions. But in the long run, particularly if we're talking about communications and closing the gaps in communication, those kind of things, it does create this potpourri that's difficult to integrate and difficult to use.
So Mark, as you mentioned the lack of integration there and that potpourri. What's your feeling of what's the impact on the patient and their not only their care but their experience with this potpourri of maybe engagement, outreach and communication with them?
No, it's disjointed. It's difficult for them if they have to continue to move between apps or move between modalities, and it's better than it was. So I am not complaining about what's been going on, but we can do it better. We can make it seamless, right? We can make it really easy for them to access the right level of care. And, that's going to take some thought.
Yeah, that's great. You mentioned the EMR, and we included that here as well, and try this idea of trying to go, use the EMR to check a lot of the boxes or meet a lot of the needs, on both patient and provider sides of the coin right now. Where have you seen difficulties and even strengths with an approach like that today? And again, beyond Mark, if you guys have thoughts here, chime in. I think we'll share a poll here in a minute, but where Mark, could you reflect on where you've seen the EMRs have their strengths and weaknesses in this respect today?
Yeah, I mean, the EMRs are really integrated, and that's nice. They're generally a single platform, particularly the major ones that are out there now. And so, data moves really quickly in a standard format between all these different functions that the EMR does, and I think that's great. I think our docs like the messaging systems that are inside the EMR because it fits within their workflow of what they're doing, right? They're spending so much time on it. It's easy to see where my messages are and the things that I need to do. And probably easier to respond because you can take data right out of the EMR and move it around. So, there is definitely an integration advantage to the EMR and a standardization advantage to the EMR. Where it gets a little hard from my perspective is, they're really big, heavy technology, right? They're big systems, millions of lines of code, lots and lots of tables that have to stay synchronized with one another. And so making changes to those EMR systems to really focus on the challenge of communication, let's say, between the various parties within the care process and, of course, the patient and the family and all those types of things, it becomes pretty difficult. And the security aspects of that raise some interest too, because you have so much PHI and you've got the whole electronic, the whole record for that patient in there, and you're doing a lot of work to secure it. So, they have huge advantages. I'm a real fan of our EMR and the EMRs that I've seen out there. But there are things that, it's just kind of hard to make a move on a dime. And I think in some of these newer areas, it might be difficult for the EMRs to keep up.
Yeah. And the third one I wanted to talk about here was based on a comment you made to me about the approach you guys have had at Intermountain which was, and I'm paraphrasing Mark Probst here, but it was, if we can't find it, we'll go out and build it. And, would love to hear some of your experience there on how you've done that so far, and what the positives and the negatives have been there.
Yeah, sure. So in the 70s, we either built the first or the second EMR. It depends who you talk to. It was called Help. At the same time, we were building Help, and I use we liberally because I wasn't here. I was in, junior high. But we built this EMR. Yeah, we built this EMR called Help, and there wasn't one out there. And so Intermountain has had this attitude for a long time and capability. And I can tell you why we're as blessed as we are, because there's some uniquenesses that Intermountain has. But we went out and we built these things. And so through our history, when financial systems weren't really available in healthcare, we built our own financial systems for years, probably until 7-8 years ago. Well, probably 10 years ago, everything was built. Our ERP system, you name it, revenue cycle, the whole 9 yards. Well, we switched like everyone else, and now there's good products out there where we're using mostly vended products. But as we looked at digital communication with our patients, we decided we needed to build a digital, basically a digital front door. It's not what we call it anymore. We call it My Health Plus, which is My Health is our portal. My Health Plus is the digital, the mobile version of it. It's pretty powerful and pretty nice. And, we started this 4 years ago. And when it was there just weren't any good solutions. I think as we look at it now, and it's built in a very modular fashion so we can bring in, products and plug it into it. I think there's a lot more in the market now that, folks don't have to do it. But at Intermountain, we build it. I don't suggest it. It's really expensive. I have a very large IS organization, about 1,300 people. So it's a big IS organization, and you need that to do the build, to do the maintenance, all the things that come around having that kind of product. But, the market wasn't there. Now I think the market's catching up. And just like in the EMR space, no one would use Help. Help was ASCII, green screen characters, had certain level of functionality. When you get big vendors like Cerner, Epic, Allscripts, they've got huge R&D and they've surpassed what we can do. That's what's happening in this space as well now around digital communication and engagement of our patients.
That's great. So, Leah, are you still out there? I know you had a poll question we were wanting to watch here.
Yep. So we just wanted to kind of get a sense of what experiences have people had, right, with the same kind of thing, like using niche solutions or using whatever happens to be in your EHR that's available to you, or trying to build your own solution. And we thought it would be sort of interesting just to see, what people have tried previously. And then we've got a follow-up question to that about how that has worked for you. So we'll give everybody just a few more seconds to fill this one in, and then we'll push out the other one too. We'll share the results. And it's funny, Mark, as you were talking about, these sort of DOS-based old things. I started my career, and anyone who's been in the industry for more than 20 years will be familiar with them, with medical manager health systems, which was one of the first and earliest practice management and EHR companies, which of course was all DOS-based, and our biggest competitor at the time was MISIS, which also was all DOS-based. Everything was, flashing little cues, on the screen. So it's been a minute, and I'm going to push out the results on this one and share those for a second. And definitely seems like, and I'm not surprised, right, that most people are using like a lot of different solutions, or are using kind of whatever's been handy in the EHR. So I'm interested to push out the next one. So I'm going to hide this, and then we'll push out the next one, which is, were those or are those methods, effective? Have they given you kind of what you needed or what you wanted? Have they been effective at improving communication and engagement?
See it now. It always takes a minute for these things to load.
I know. It's like, well, and sometimes it's funny. You notice that like sometimes some people can see them and some people can't. We often get people who say like, I'm trying to answer the poll and I can see it, but I can't answer it. This technology. as we're talking about technology, technology is a challenge.
Yeah, I can see the numbers kind of growing from as a presenter here, and there's a lot of sometimes. This is not a definite yes, not a definite no. There's a lot of yeah, kind of, and sometimes.
Yeah.
And
Mark,
is that,
I'm gonna push this one out too, because we've had we're almost at a minute here, and just share so other people can see it too. Definitely the majority is in the sometimes.
Mark, would you say that's pretty true to your experience?
Absolutely. I mean, absolutely.
This might be a good time. We've had several people, so I'm going to hide the poll, and it'll go back to Justin's screen, but there have been a lot of people, Mark, who've been saying, what do you do, or what are some recommendations from both of you, Mark and Justin, around how do we do a better job of bringing patients into these, how we make decisions or get their feedback around whether or not things are working. What are some of the thoughts and suggestions you have from what you do at Intermountain, and Justin, just from our experience, around working in this area, about how to engage patients more and get their feedback and understand their experience better?
Sure. I mean,
yeah,
and
go ahead, Mark. No, you go ahead, Justin. No, go ahead, Justin.
That patient feedback loop has got to be there in terms of how we're surveying patients and getting that real-time feedback or after the fact. And Mark, how have you guys done that at Intermountain?
Well, I would just say that nobody wants meaningless communication, right? I mean, it needs to be relevant, and it needs to be appropriately focused. And we also don't want the 4 different people calling us for the same thing, whether it's a lab result or a scheduling a visit or whatever it might be. So coordination becomes really important. At Intermountain, we've always felt, at least for the last 10 years, we felt, I guess, that transparency with the patient is incredibly important. And if you're going to have them become engaged in their care process, we need to be providing relevant information to them in a timely basis. And then we need to allow the interchange to happen. Nothing's more frustrating than getting a lab result, a PSA or whatever it might be. And we can send the nice text document that says this is what it means and this is the range. But what you really want to do, particularly if you're out of range, is you want to talk to somebody. And I think we've been a little bit, hey, it's okay just to push it out. Our docs are real busy, so and our MAs are real busy, so we don't want to bother them. And that is just exactly the wrong attitude. We need to be able to provide this information to our patients and whoever they suggest, their family members or whoever that they would like to have as part of that care process. And then we need to allow for very simple, very timely interchange. And then they're going to get engaged. It's like you and I talking, Justin, we're talking to one another, and that happens naturally. If it were not so natural, it would make the discussion harder, and I don't think we get to the points we want to get to. So those are my thoughts. And that's what we're doing. Yeah. We're just surfacing, hopefully, good information to the patient.
Yeah, that's great. So kind of the last piece that we wanted to do for the group here, and again, still thanks for all the questions you guys got a good number of them in there, is what, knowing what we need to do, knowing where we've been, and Mark walked through a few of those, quote unquote solutions to date, and we heard from everyone here in terms of how they've been approaching it, is a few thoughts on how do we move forward. And one of these that I think is really good is, here we are at, depending on when this became serious, area of focus for you, we're kind of at the 3 mark here, or the 3 month mark here. So it's time to kind of step back and take a deep breath. And Mark, share your thoughts on that, because you had some good ideas when we talked through this before.
Yeah, I mean, we just had to move so quickly, so there wasn't a lot of time to plan or to, really think through how everything was going to integrate. Were we going to use Zoom? Were we going to use Teams? Were we going to use something else? And we just did it. And to me, what is it? Measure twice, cut once is what the carpenter's term is. And we weren't doing a lot of measuring. We were just cutting and doing stuff and getting it done. I do think either it's right now and maybe too hard in some places, but I think we're getting to the point where we need to step back and really measure twice. What is it we're trying to accomplish here? What are we trying to accomplish with our providers? What are we trying to accomplish with our patients, our members, whatever it might be? And take a breath and say, okay, how are we going to do it? Are we going to use the technologies we just deployed, or are we going to look for different solutions? And it's going to be a combination of things as we look going forward. And this bullet's in here because of me. I just think platforms are a more elegant solution. I don't need every solution handed to me. What I need is the technology in place, and then someone that's smart enough to help me use that technology to do the integration, to do the communications and those kind of things. And frankly, that's why we all went to EMRs. And frankly, that, why we have had integration engines and now we have new products to support what we're doing. But I do think it's a good time to just step back, take a breath, and figure out, what's out there. Good grief. I got to believe 200 companies were formed over the COVID time. Well, what do they have? Oh, yeah. Right? We need to take a look. So that would be that's what I think we're going to do.
Yeah. And then another point you'd made was, surely this is, not the first and or even the second or third time in your career you approach things this way, but just kind of learning from the past and learning what you'd been through here. And you mentioned that you guys at Intermountain had you acted quickly and you had a plan that you had to enact in really short order. And it wasn't that it wasn't strategic. It certainly was. But maybe not the long-term solution there. Any reflection on that, Mark?
Yeah, I mean, it's what you just said. We all have to learn, and you know what? I didn't put it in there. We didn't talk about it in the take a breath, but kind of be really proud of what you did as well. And I'm proud of what our industry has done. I am proud of my peers and comrades in arms in the CIO world and in healthcare IT and healthcare of what we did do. And now let's go learn from that and let's go see how to do it better. And anyway, I like that concept, and I'll leave it at that.
Yeah. Good way to live our lives anyway. And then, the third thought here that you and I discussed was just around the technology landscape, and that it's kind of along the same theme of where we've been a little bit already in the discussion today, but around thinking through, okay, well, we had some short-term solutions, stuff we had to do quickly, and I think put this I put this in here directly from something you'd said, duct tape and baling wire. But how do you balance that versus the longer term view? And so, curious again to get your thoughts there.
Yeah, and we've gone through it a few times, but we did bring in a lot of short-term solutions. We did, we also had some interesting changes from a regulatory perspective. The government relaxed things around security and using some of the products that were out there. We all have to understand that's not going to last. Some of it will. I think some of the payments, some of the cross-state line regulatory changes that were made will likely stick. But I certainly believe the things around security and privacy, we're going to see that get locked down again pretty quickly. And so we got to look at what we did. We got to see how, and because we were allowed to be a little more flexible, it was okay. But, like I said, going forward, we're going to have to pay attention to it. We're going to have to make sure we have things that are highly secure, meet those regulatory requirements, and that way we won't get fined and we'll get paid. So yeah, and technology is changing so rapidly. So, it's hard to keep up with it. But it's important for us to have people that are focusing on keeping up with it.
That's great. And so we'll get to some questions too in a moment, but I'd be remiss if I didn't invite you guys to continue that discussion with us. And that can be, through continuing to ask some questions here in the forum or even sending us an email at info@srhealth.com. For SR Health, if you're not familiar, that's our new brand with Solution Reach. And that's, Mark spoke to that single platform approach, and that's what we're trying to do and bring that to the table to meet all of these emerging patient engagement and communication needs from both the patient and provider's perspective. So feel free to, I think there'll be a survey as you leave the webinar here in a moment, where you can request some more information. We'd love to just have a conversation with you and tell you more about it and show you where some of your peers are seeing success with that today. So again, just email us at info@srhealth.com. And if we've got more questions, feel free to fire away. We've still got a few moments. I know we want to respect your time, and so we'll plan to cut it off at the top of the hour. But if there's more out there, let us know. And Leah, if you're seeing anything that you want to bring up.
Yeah, for sure. I mean, there's definitely a couple of quite a few additional questions, but a couple of clear themes in the questions. Following up on the stuff we kind of talked about around trying to engage patients and get that patient feedback and, have the patient involvement in the process, we've got a specific question asking about, for you, Mark, about Intermountain, but Justin, I think you can probably add to this too, around, how to try to ensure that you're being, engaging patients with a lot of these other things in mind, like social determinants of health or education levels, language, those kinds of things. What are some of the strategies, if that's something you can chat about really quickly that you guys use, or, Justin, if you want to contribute some of the suggestions we make around those things?
Yeah, I think short of a technology discussion, which, I'm a CIO, so I can gravitate there pretty quickly. But I love, the whole social determinants of health. At Intermountain Healthcare, we have what's called the executive leadership team. That's 12 individuals that really lead the whole organization. That includes the CEO and a lot of those folks. One of those people is community-based, and their whole focus is around engaging the patient along with our communication people and looking at things like social determinants of health and really understanding it. I mean, we have, you'd think someplace like Salt Lake City, it's relatively small, relatively wealthy, not as diverse as some parts of the country, that we would have good parity of care across our whole state and all the places we serve. We have huge discrepancies in care. So I think part of the answer is dedicating the energy in what you're trying to do. It's easy to take care of language, right? We can, changing the language within any of our technologies, well, not any of it, but a lot of the technology today is a relatively simple thing to do. We ought to pay attention to that. We ought to know which languages we should be focusing on, and that's having people and data to focus on it. And the same thing on social determinants of health. We need to understand what the problems in our community are. Again, kind of looking at Utah, you think maybe you don't, but I think, wow, this is kind of a really special place. But we have huge problems in things like younger people and suicide. And, it's not a really well understood issue, but we've dedicated our organization to reducing that number. And because we put the focus in it, we've used the technology, we use communication, we've used all these different things, we actually have been able to impact that statistic pretty well. So, it's definitely, what are we going to focus on and then do it?
I think just to add to that with a little bit of different perspective, I tend to think of this from how I approach, my role as a marketing professional. And that's the idea of not being stubborn about how we communicate. I think about how we communicate to our own customers at SR Health and Solution Reach, and always having this spirit of experimentation with that and changing the way we say things and testing different messages and testing different modalities and just being open-minded about how we do that and not set in our ways and not tied to one specific way we say things all the time. So how do we build in ways to test which outreach to a patient is more effective than another, and just making sure we're staying open-minded there to maximum impact.
Yeah, it's interesting. Yeah, I was going to say. Well, and I was going to make a comment too that there were some questions too about how do we, increase confidence among patients to come back, and I think some of these same things apply that we've been talking to. And whoever asked that question, I just wanted you to kind of know. I think these are the same things that we've been saying about, communication and, really being aware of people's, where people are right now, and the better you can communicate and kind of target your communication and be thoughtful about what patients need to know about, what you're doing and how you're keeping them safe and those kinds of things, that's obviously a huge piece of that. But the last question for our last 2 minutes is definitely a Mark question. And it's from someone sort of saying, with all of these technologies and all of the things we're having to do right now, how do we balance making sure we can get the care to patients and engage them and do all of that with ensuring that we're still being thoughtful about security?
Wow, that's a great question.
Can you give it to Can you give it 2 minutes answer to that? Sorry.
Well, security is a very complex situation, right? And keeping on top of regulatory change, keeping on top of the security tools and practices that are out there, that is a full-time job. I've got about 27 people that's all that they do. And I'm really blessed to have that. I think in smaller organizations where you don't have all those people and all that focus, you got to lean very heavily on your partners to help you filter through the things that are important and making sure that you're meeting those requirements. But, it takes brains and it takes lots of them and it takes some investment.
Great. Thanks, Mark. Leah, I think we're just under the 1 hour cutoff here, so let's go ahead and call it here, you guys. But again, if you have questions, I'll leave the panel open for a moment so you can submit any more. And again, you can let's see if I can go back one here. You can always email info@srhealth.com. But before we go, I just want to mention, again, thank Mark so much for the time, just brilliant insight, and so appreciative of him, and Leah as well for helping us moderate today's session. And thank all of you for attending. And that'll wrap it up. We'll send the recording to everyone, and we'll hope to chat with you next time. Thanks, and have a great afternoon.
Thanks. Bye now.